Alright, now let's go to the guidelines for developing a prenatal exercise program. No? So some of the guidelines here were adopted from your ACOG or your American College of Obstetricians and Gynecologists guideline. Okay? So we'll discuss here your absolute and relative contraindication, warning signs of terminating the exercise, and prenatal exercise prescription. Okay? So for the ACOG absolute contraindication, these are the absolute contraindications. Okay? Hemodynamically significant heart disease, no? So basta may heart disease, ayan, no? Contraindicated po. Restrictive lung disease, because as you can see, no, meron kang increased demand. Okay? Meron kang overbreathing. Okay? So baka given that situation, okay, baka hindi lalo kayanin ng lung, no, if the pregnant women has a restrictive lung disease. No? Baka mas lalong hindi niya kayanin kasi adding on top of it the exercise demand, no? So, ayan, baka di niya kayanin. Okay? Incompetent cervix or cerclage, no? Ibig sabihin, ito yung sinasabi nila in layman's term, no, mababa yung kapit ng bata. Okay? Multiple gestation at risk of premature labor. This is usually, no, may mga, lalo na yung mga masalan magbuntis, if they have twins, okay, or more. No, merong mga triplets, okay, so they are absolutely contraindicated to this. Persistent second or third trimester bleeding, okay, so kahit spots lang, no, bawal. Placenta previa after 26 weeks of gestation, okay. Preterm labor during current pregnancy. No, so, ibig sabihin, nagkaroon sila ng contractions. Okay? Nagkaroon sila ng contractions or yung parang increased tension sa tummy nila. Okay? So, yan yun. Ruptured membranes, preeclampsia or pregnancy-induced hypertension, and severe anemia. Okay? So, aside from this, no, I'll be giving you as well the absolute contraindication exercise positions. Okay? So, first would be your fire hydrant position. Ito siya. No, madalas, included kasi ito sa sa exercise program ng women. No? Madalas meron talagang mga hydrant positions. So, for pregnant women, bawal sila sa ganitong position. You also have your bilateral SLR, bilateral straight leg raising. Bawal din sila dyan because with the already stretched rectus abdominis because of the bulk of their tummy, no? So, stretched na yung rectus abdominis, it wouldn't be able to contract efficiently, no? To control yung bilateral SLR as it descends. Okay? Yung pag-descend yung problem natin dito. Because if the rectus abdominis is weak, obviously because of the stretch, ang magko-compensate niyan would be the lumbar group of muscles. Wherein, no, it could result to certain injury. So, bawal ang bilateral SLR. Okay? Quadruped. Okay? Quadruped, wherein naka-hip extension, bawal din po. Okay? And then, unilateral, weight-bearing activities. Bawal din siya. Kaya mapapansin nyo, in exercise program for pregnant women, no, palaging double leg ang mga weight-bearing natin. Okay? May mga, makikita ka sa mga certain shows, okay? Mga celebrity na prenatal exercise, di ba? Meron yung mga nagbubuhat pa, okay, ng barbell, okay? So, yon, no? Pwede, as long as it's not unilateral weight-bearing activity. Let's go to the precautions. Precaution, kanina, no, severe anemia ang contraindicated. Pagka naman anemia lang, no, hindi naman siya ganun ka-severe, precaution. Okay? So, in here, no, pag itong list natin for precautions, no, woman with one or more complications, no, may exercise. As long as meron siyang close monitoring of a physician or a therapist. Okay? As long as no complications arise, pwede siyang mag-continue. Okay? Although, no, with this women that has precautions, exercises may require modification. Okay, so we have anemia, unevaluated maternal cardiac arrhythmia. So, dahil unevaluated siya, ibig sabihin, dumating siya sa'yo, and then upon taking the history of the patient, meron siyang mababanggit na ganito. Alright? Merong arrhythmia, arrhythmic events. Chronic bronchitis, extreme morbid obesity, extreme underweight wherein ang BMI niya is less than 12, history of extreme sedentary lifestyle. Okay, kasi dito, mahirapan kayo na yung transition, no? I think that yung extreme sedentary lifestyle plus naging pregnant sila is already a challenge to them. So, kakailanganin nyo dito ng talagang pag-tailor nung exercise program wherein hindi talaga siya masyadong mabibigla. Okay? Because the pregnancy is already a challenge to this kind of individual. Orthopedic limitations, poorly controlled type 2 diabetes, hypertension, or seizure disorder, or hyperthyroidism. Heavy smoker. Okay? So these are the precautions, no? Now, let's discuss the warning signs to discontinue the prenatal exercise. Ano yung iwa-watch natin? Alright, no? So, warning signs to discontinue. Vaginal bleeding. Okay? So, pagka during exercise, nagkaroon ng vaginal bleeding, that's a sign to discontinue. Regular painful contractions, no? So, maybe once or twice, okay lang. Pero pag palaging nagkakaroon ng painful contraction, you would want to, or persistent, no? Kunwari, during exercise, you had a painful contraction, you asked the patient to rest, and then after you came back to the exercise, nawala siya, no? And then, biglang nagkaroon ulit, no? Kinontinue yung exercise, nag-rest, and then nag-exercise ulit, tapos meron pa rin, you would have to stop the prenatal exercise. Amniotic fluid leakage, okay, definitely. Dyspnea before exertion, dizziness, headache, chest pain, muscle weakness affecting balance. No, we wouldn't want the patient to have secondary complication due to falls. Calf pain or swelling. Okay, yan yung mga warning signs to discontinue prenatal exercise. As for the calf pain, no, this is more of the developing DVT, no. You would want to be alert, no, na not to further induce yung pag-dislodge ng thrombus, no. So, yun yung for the calf pain. Okay. Now, for the prenatal exercise prescription, no, we have intensity, duration, type, and frequency. No, ito yung mga parameters na titingnan ninyo when you prescribe prenatal exercise. For the intensity, no, this is moderate to somewhat hard level. No? So, in a 1 to 10 rating of perceived exertion scale, no, kapag 1 to 10 yung basis natin, this should be around 3 to 4 only. Hindi talaga siya ganun ka-intense. Okay? This is because, no, ayaw natin na masyadong ma-overtrain si patient to the point na hindi na siya magiging compliant. Minsan tatama rin na siyang mag-exercise. Okay? Also, you will have to utilize stock test. Okay? So, ang basis natin here, no, hindi talaga sa heart rate. Okay? Because, no, training heart rate is a poor indicator of maternal exertion level because of the cardiovascular and hormonal alterations. Kaya ang tinitingnan natin kung kaya pa talaga ni patient is more on the talk test. Okay? In here, you would want to familiarize the client on the talk test to gauge her exercise intensity. No? For you to know na kaya pa talaga ni patient, the client should be able to carry on a conversation while exercising. Okay? So, while exercising, dapat kaya niya pa rin magsalita. Ganun lang ka-mild ang exercise ng pregnant women. Okay? As the pregnancy progresses, no, intensity will need to be modified. No? Imbis na pahirap tayo ng pahirap, it's different. No? Because there's an increasing weight that will add to the workload. No? Dahil bumibigat na yung baby, you will have to decrease the intensity of the exercise. No? So, yun ang progression ng exercise natin pagdating naman sa pregnant women. This is your RPE. No? So, somewhat nandito siya. 3, 2, 4. Hindi siya hard. Dapat somewhat hard lang. Okay, moderate to somewhat hard. As for the duration, no, there's about 20 to 45 minutes allotted for aerobic exercise per session. Okay? In later pregnancy, exercise session duration may be divided into 2 sessions. So, instead of continuously doing it 20 to 45 minutes, dahil nga medyo mas mabigat na yung tummy ni pregnant, okay? So, you might want to divide, okay, into 2 sessions. Kunwari, 10 minutes muna ngayon, and then a little later on, 10 minutes ulit. Okay? This is to if shorter duration is better tolerated. Okay? Kung better tolerated siya ni patient. So, paano nyo malalaman? By talk test. Okay? So, kung sa talk test, no, talagang mukhang hanggang 10 minutes lang kakayanin ni patient or 15 minutes, okay, then hanggang dun lang na. Okay? Ayan. So, that's for your duration. As for the exercise type naman, okay, activities that pose least amount of risk and are convenient for client is strongly recommended as the exercise type. Ano-ano ba yung mga exercises na yun? This could be walking, jogging, or running. Yung mga merong exercise machines like your stationary bike, rower, or elliptical. Okay, swimming pwede din. Yan. Kung merong swimming pool, si patient, no, yayamanin. Meron siyang swimming pool sa bahay, no, kasi kailangan convenient for the client. Mamaya, wala naman siyang swimming pool, ipupush mo pa, no. So, dadayo pa siya kung saan-saan. Alright, so we don't want that din naman. Okay? Absolute contraindication, ano yung mga bawal, no? Although, kunwari, si patient, no, scuba diver talaga siya before, since pregnant siya, bawal muna. No? Bawal siya sa scuba diving, okay, water skiing, saunas, and hot tubs, bawal. Relative contraindication, ibig sabihin, depende, no? Depende dun sa physician kung papayag, right? Downhill skiing, high-altitude sports, no? This is because, di ba, meron nga tayong increased oxygen uptake. Okay? And may overbreathing si patient. So, pag high altitude, there's lesser oxygen available. So, kaya, as much as possible, ayaw natin muna sa high-altitude sports. Cross-country skiing, ice skating, gymnastics. Gymnastics, I'm not really sure, no? Kung merong mga pregnant women would want to do gymnastics while they are in pregnancy. Horseback riding, no, bawal. No, masakit sa tiyan to. Alright? Okay, so with all of the absolute contraindication and relative contraindication, paano tayo pipili ng exercise type for the patient? So, one of the guideline for this is that you should choose activities that are enjoyed and make compliance easier for the patient. So, dito magkakaroon ng big role yung history taking nyo kay patient. So, social history niya, okay, doon nyo madedetermine ano ba yung mga bagay na medyo familiar siya and would make the compliance easier. Okay. You would also want to take note, okay, if that activity is easily modified as pregnancy progresses. Okay? And also, always assess risk-benefit ratio to your activity. So, pag masyadong risky, wag na lang. As for the frequency naman, okay, aim for at least 3 days a week and up to 6 days a week if well tolerated. No? Pero kanina, di ba, sa previous discussion natin, ang pinaka-optimal talaga is 5 days a week. Okay, so tips for determining the exercise frequency, no, would be the current level of fitness. So, kung medyo sedentary si patient, you would want to start with at least 3 days a week. Okay, and then, ipo-progress nyo na lang siya. How pregnancy is progressing, ibig sabihin, maselan ba yung pregnancy ni patient or not? Okay, are there complications arising or not? Okay, type of activity and intensity, this depends on the exercise type that you will be choosing. And, although si patient, kunwari, medyo sedentary siya, so ang gagawin nyo, 3 days a week lang, you will have to build in a day of active rest. Ibig sabihin, kung Monday, Wednesday, Friday ang session niya, Tuesday, Thursday, Saturday, and Sunday, dapat merong active rest si patient. Meaning, she's resting, she's not doing the exercise program, but there's an allotted activity, okay? At least 1 to 2 activities for the patient to do during that days. Okay? So, para matawag natin siyang active rest. Okay? Yeah. No? So, alright. So, this would be the part 2 of the obstetrics prenatal. No? So, the next part would be the last part. Okay? We'll go on to the exercise modification techniques and flexibility and strength training for pregnancy.